Imaging. Imaging, you have the whole gamut of investigations available. You can take a radiograph, you can take a CT scan with or without contrast, you do an MRA plain or contrast. Suspecting malignancy, you can do a PET CT. All patients with low back pain, it's better you get an ultrasound of the abdomen and also a radiograph of the chest to exclude the possibility of TB, especially when the ESR is elevated. This is very interesting, this particular person, the slide is actually borrowed because I don't have the original slide, came with severe low back pain. Very excruciating. We did an MRA, found marrow edema, and we did a bone marrow biopsy. A second found out to be bone metastasis secondary to malignancy in the colon. So just don't ignore low back pain. Okay, that's very important. You've got to take any person's back very seriously. The last few slides which I like to tell you is this condition called ankylosing spondylitis, which you should definitely be aware of in clinical practice. It is genetically inherited with unique characteristic fusion of the sacroiliac joint and the classical bamboo spine, which you see on the right side of the film. How will you diagnose ankylosing spondylitis? It is a disease predominantly seen in males. Predominantly seen in the age group of 20 to 40 years. Classical symptom is inflammatory low back pain. That is pain, worse in the night, worse early in the morning, with severe early morning stiffness, becoming better as the day progresses. That's very, very important. One hand, you have inflammatory low back pain, which is a nocturnal and early morning low back pain with stiffness becoming better with activity. On the other hand, you have a mechanical low back pain, which is worse after activity, becoming better with rest. Clinical examination of them, they have limited chest expansion due to involvement of the costovertebral involvement, limited lumbar spinal flexion and spinal extension, and very important, radiography will show bilateral sacroiliitis. Now I can tell you, ladies and gentlemen, the ideal investigation to be done to make an early diagnosis of ankylosing spondylitis is to get an MRA of the pelvis, where you'll get an inflammatory sacroiliitis. There is no need to do HLA-B27 in everybody. It's not at all essential, but it's positive in 95% of ankylosing spondylitis. Just because my HLA-B27 is positive, it doesn't mean I'll have ankylosing spondylitis. You should always, the HLA-B27 is always complementary to a diagnosis of spondyloarthritis. So ankylosing spondylitis, I told you 20 to 30 years, more common in males and females. Don't think that ankylosing spondylitis is not seen in India. It is seen in nearly 0.83% of the Indian population. And this is very, very important message for everybody. Why you should not miss ankylosing spondylitis. Nearly 25% of ankylosing spondylitis, they present in the crippled stage needing surgical intervention. Reasons are poor disease awareness in the community, even among the doctors also. Patients are not bothered when they have inflammatory low back pain. The earliest time when we are able to make a diagnosis of ankylosing spondylitis in India is to 7 to 8 years after the onset of the disease. There is a 7 to 8 years delay in the patient with ankylosing spondylitis going to the doctor. By the time the damage is already done. That's very, very important. And people are not compliant with drug treatment and exercise. Ankylosing spondylitis, ladies and gentlemen, it is not curable, it is controllable. Wonderful drugs are available. These people have to take medication for lifelong. They have to do exercise lifelong. You tell all this to the patient, he'll run away from you. But I will tell the truth to them. Truth is bitter, but it is better and best to tell the truth to everybody. Do not forget to think of ankylosing spondylitis when any young person, especially a male, even it occurs equally in females also now, when they present with nocturnal low back pain, early morning low back pain, stiffness, becoming better with activity. There is a family history of ankylosing spondylitis in that family. Please think of ankylosing spondylitis and start treating them as early as possible, because if you treat them late, it is like closing the stable after the horses are sped. That's very, very important. So the treatment of ankylosing spondylitis, it is a holistic approach. Every low back pain, you should have a holistic approach in treatment. You give medications to reduce the pain and inflammation. Then you give medications to arrest the disease process. You have very important physiotherapy exercise. You educate the patient regarding the chronic nature of the disease. And occasionally we have to take them to surgery, especially a hip replacement or correction of a kyphosis in the spine. Treatment of ankylosing spondylitis, you can give non-steroidal anti-inflammatory drugs for a short period of time for not more than 3 months, but they have no effect on the disease process. Now, a lot of people give disease modifying drugs in ankylosing spondylitis. I would like to tell you one thing very, very important. Methotrexate and sulfasalazine have no effect on the axial disease. This is very important. And sulfasalazine is useful only in the peripheral arthritis, the spondyloarthritis. So if you see an ankylosing spondylitis person with predominant axial disease, don't put him on sulfasalazine and methotrexate. It is an absolute waste, which is now it is proved that it is useless. Exercise is a sheet anchor, not only in the management of ankylosing spondylitis, but any person with low back pain. Exercises, regular stretching exercises, muscle strengthening, breathing exercises. Swimming is exceptionally very good. Hydrotherapy, yeah, we have certain areas. We have hot water, steam baths and hot water hydrotherapy is available. Posture correction. This is very important. We have to stand erect. It's high time we retain our spine in this world and stand erect. And we have to educate the people in their activities of daily living. Especially angspon, no pillows or very thin pillows, use a firm mattress. Exercise and swimming are very, very important as far as ankylosing spondylitis is concerned. Diet for ankylosing spondylitis, nothing. You eat whatever you want. You see the carrot is jumping, but no alcohol. This fellow is doing the wrong thing. The other guy is also telling no smoking. This is very, very important. And you have to have a well balanced diet. See the other one, pizza or something like that, highly nutritious. Avoid junk foods, so that you don't become obese. Now, this is the most important side. The treatment of ankylosing spondylitis nowadays, at present, the drug of choice is called biologics. These biologics specifically act against inflammatory mediators which are responsible for spinal inflammation and spinal destruction and newborn formation. We have two classes called anti-TNF and IL-17. But these are the drugs of choice. They reduce inflammation, they reduce the spinal stiffness, and they also have been found to have a beneficial effect on retarding the disease progression, both in the spine and peripheral joints. So, the drug of choice in treating ankylosing spondylitis is present is biologics, and nothing but biologics. One rare side effect of biologics, it is being a little immunosuppressive. There is a risk of less than 1% developing tuberculosis. It can happen in any part of the world. So before you start a person in biologics, we ask for a history of TB, history of exposure or contact to a person with tuberculosis, and then we do the tuberculin test, we do the TB quantiferon, get an X-ray chest. If there's some abnormality, we may like to even get a CT chest and a bronchoscopy. So we have to exclude TB before we start biologics in any patient. You see this patient, how he is crippled. What can I do to him at this point of time? He can be an academic pride for me, I made a diagnosis of ankylosing spondylitis. But I can convey only my sincere condolences to him and say, sorry, I cannot do anything. You know why? He presented to me after 10 years. So, ladies and gentlemen, remember inflammatory low back pain, nocturnal pain, early morning pain, becoming better with exercise in a young male or a female, kindly think of ankylosing spondylitis, where MRI will be the gold standard. Now, I should accept the mistakes which I have done in my life. See, a man can become perfect only if he's done mistakes, If he says I've never done a mistake in life, that means there is something wrong with him and he can never achieve perfection. Either you learn from the other man's mistake, if God is very kind to you, or you learn from your own mistakes. If you do not learn from both, nobody can help you, including God also. Never dismiss low back pain as psychogenic. That is last in the priority. What all I have missed is I missed neurogenic claudication. I took people with calf muscle pain very easy when it turned out to be a lumbar canal stenosis. I have forgotten to ask for bladder and bowel symptoms in patients with low back pain. I forgot to take the gynecological history in a woman with low back pain. And this is the last one, not looking for lumbar corset. One patient came to me with low back pain and I examined his lumbar spinal movements without removing his shirt as well as his pants. And I found his lumbar spine movements decreased, both flexion as well as extension. Immediately, I said this is ankylosing spondylitis. I asked him to get an X-ray done. The X-ray showed a normal sacral leg joint. Oh, X-ray is normal sacral leg joint. Then how can it be ankylosing spondylitis? I examined him again. This time lumbar spinal movements are absolutely normal, both flexion and extension. And then you know what happened? I just took his shirt and I was asking him to bring his pants down. I asked him whether he was wearing a lumbar corset the previous day. He said he was wearing it. I missed the diagnosis. If I had only taken his shirt up and his pants down, I would have seen the lumbar corset and said that this is not pathological at all. So what I'm telling you, very, very important, a good history and a good clinical examination. We all mature with age, nothing wrong in doing mistakes. So the carry home message, ankylosing spondylitis is a debilitating disease. Early diagnosis, early intervention with biologics is very, very important. So this is the last slide. The carry home message as far as low back pain is concerned. A cause for low back pain, the outcome is best if it is diagnosed and treated early with good compliance from the patient. You need social awareness of these conditions. Always look a little beyond the disc. The cause can be mechanical, it can be non-mechanical like malignancy, it can be infection, it can be auto-inflammatory, immunoinflammatory like ankylosing spondylitis, it can be Paget's, it can be osteoporosis, it can be fracture, it can be infection like tuberculosis and discitis. Last but not the least, it can be visceral, especially what you call from like pancreas, pancreatitis, prostatitis, and then in women you think of gynecological diseases and endometriosis. Renal colic can cause it. Hydronephrosis can cause this back pain. If you have excluded all the causes, it can be from the mind, because you know there's a relationship between the mind and the body, the psyche and the soma. So people with mental depression and anxiety, they get into what is called a somatization and they can present with low back pain. Ultimately, the most important point, it is no use going to the grave and dancing like these skeletons and saying life is mobility and mobility is life. You should be able to dance like this when you are alive. That's very, very important. So please do exercises daily, go for a walk, do back exercises regularly, and very, very important is what is called ergonomics at your workstation, at your home, etc. You have to maintain the proper posture, sitting down, workstation, lying down, then even standing is very, very important. And all of us nowadays are sitting in the computer, especially with work at home. You work from home and you also have work at home because you become domesticated. So you should probably change the ergonomics at home with respect to your work environment. A perfect chair. In fact, now I'm sitting on an ergonomic chair. So I don't think I will develop back pain after having sat here for nearly 1 hour. So be aware of ergonomics and ergonomics. And you see this guy is sitting and like this and he's sleeping. Naturally, he will come with low back pain to you or me one day. So thank you very much. I finished my lecture. If there are any questions people could ask me, I hope was very clear. Whatever I knew, I said. I know that I know very, very little. I don't know a lot. If anybody has got any doubts, if I can answer the question, I'll ask. If I do not know the answer, I'll read and get back to you. My knowledge is absolutely zero at present. The whole credit goes to the Almighty who's speaking through me. Thank you.